Hello students, welcome to the lecture on mental health, and after this lecture we will be able to learn the following objectives. Describe mental health, explain significance and perspective of mental health, describe causes of mental disorder, describe emotional mental health issues and its improvements, explain prior mental health conditions. First of all, tell me students, what do you think mental health is? Do you people have any idea regarding this topic? Anyways, let's start with the term mental health, which is commonly used in reference to mental illness. However, knowledge in the field has progressed to a level that appropriately differentiates the two. Although mental health and mental illness are related, they represent different psychological states. Mental health is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. It is estimated that only about 17% of US adults are considered to be in a state of optimal mental health. There is emerging evidence that positive mental health is associated with improved health outcomes. Mental illness is defined as collectively all diagnosable mental disorders or health conditions that are characterized by alterations in thinking, mood or behavior, or some combination thereof associated with distress and impaired functioning. Depression is the most common type of mental illness, affecting more than 26% of the US adult population. It has been estimated that by the year 2020, depression will be the second leading cause of disability throughout the world, trailing only ischemic heart disease. Health is a state of being hale, sound or whole in body, mind or soul. Mental health today is recognized as an important aspect of one's total health status, is basic factor that contributes to the maintenance of physical health as well as social effectiveness. In the words of John, Sutton and Webster, is a positive but relative quality of life. It is a condition which is a characteristic of the average person who needs the demands of life on the basis of his own capacities and limitations. By the word relative, we imply that the degree of mental health which an individual enjoys at a time is continuously changing. It means the ability to balance feelings derives ambitions and ideals in one's daily living. It means the ability to face and accept realities of life. It connotes such habits of work and attitudes towards people and things that bring maximum satisfaction and happiness to the individual. But the individual gets this satisfaction and happiness without any friction with the social order or group to which he or she belongs. Society has certain value system, customs and traditions by which it governs itself and promotes the general welfare of its members. It is in this, the social framework, that the internal adjustment has to be built up. Only then the individual becomes a person who is acceptable as a member of society. It is an understandable fact that social forces are in constant flux. They are constantly moving and changing. Similarly, our internal adjustment is also affecting various stresses. As such, mental health is a process of adjustment which involves compromise and adaptation, growth and continuity. Other definitions of mental health refer to such abilities as of making decisions, of assuming responsibilities in accordance with one's capacities, of finding satisfaction, success and happiness in the accomplishment of everyday tasks, of living effectively with others, of showing socially considerate behavior. Now let us move on to the other topic, where we will learn about the history of mental health. Many cultures have viewed mental illness as a form of religious punishment or demonic possession. In ancient Egyptian, Indian, Greek, and Roman writings, mental illness was categorized as a religious or personal problem. In the 5th century BC, Hippocrates was a pioneer in treating mentally ill people with techniques not rooted in religion or superstition. Instead, he focused on changing a mentally ill patient's environment or occupation or administering certain substances as medications. During the Middle Ages, the mentally ill were believed to be possessed or in need of religion. Negative attitudes towards mental illness persisted into the 18th century in the United States, leading to stigmatization of mental illness and unhygienic and often degrading confinement of mentally ill individuals. In the 1840s, activist Dorothea Dix lobbied for better living conditions for the mentally ill after witnessing the dangerous and unhealthy conditions in which many patients lived. Over a 40-year period, Dix successfully persuaded the US government to fund the building of 32 state psychiatric hospitals. Although large inpatient psychiatric hospitals are a fixture in certain countries, particularly in Central and Eastern Europe, the deinstitutionalization movement has been widespread, dramatically changing the nature of modern psychiatric care. The closure of state psychiatric hospitals in the United States was codified by the Community Mental Health Centers Act of 1963, and strict standards were passed so that only individuals who posed an imminent danger to themselves or someone else could be committed to state psychiatric hospitals. By the mid-1960s in the US, many severely mentally ill people had been moved from psychiatric institutions to local mental health homes or similar facilities. The number of institutionalized mentally ill patients fell from its peak of 5,60,000 in the 1950s to 1,30,000 by 1980. By 2000, the number of state psychiatric hospital beds per 1 lakh people was 22, down from 339 in 1955. Though the goal of deinstitutionalization, improving treatment and quality of life for the mentally ill, is not controversial, the reality of deinstitutionalization has made it a highly polarizing issue. While many studies have reported positive outcomes from community-based mental health care programs, including improvements in adaptive behaviors, friendships, and patient satisfaction, other studies have found that individuals living in family homes or in independent community living settings have significant deficits in important aspects of healthcare, including vaccinations, cancer screenings, and routine medical checks. Though the deinstitutionalization debate continues, many health professionals, families, and advocates for the mentally ill have called for a combination of more high-quality community treatment programs like intensive care management and increased availability of intermediate and long-term psychiatric inpatient care for patients in need of a more structured care environment. Many experts hope that by improving community-based programs and expanding inpatient care to fulfill the needs of severely mentally ill patients, the United States will achieve improved treatment outcomes, increased access to mental health care, and better quality of life for the mentally ill. Our mental health has a huge impact on every aspect of our life. Good mental health means appreciating our achievements and accepting our shortcomings. A mental illness can cause an inferiority complex, a negative body image, an intense feeling of self-hate, anger, disgust, and uselessness, which could mutate into extreme depression, psychosocial disorders, or eating disorders. Students with mental problems socially isolate themselves and develop anxiety disorders and concentration problems. Good mental health ensures an all round educational experience that enhances social and intellectual skills that lead to self confidence and better grades. Mental health largely contributes to the functioning of human relationships. Mental illness can hamper even basic interactions with family, friends, and colleagues. Most people suffering from mental illness find it difficult to nurture relationships, have problems with commitment or intimacy, and frequently encounter sexual health issues. An inability to handle stress or anxiety can cause insomnia. Even if we manage to fall asleep, we may wake up a dozen times during the night with thoughts of what went wrong the day before or how bad tomorrow is going to be. We may develop severe sleeping disorders which leave us exhausted and less productive. People with mental disorders are more prone to indulging in comfort eating or emotional binges. Finding comfort in food is something we all do from time to time, but with a mental illness, it becomes difficult to control ourselves. Our mental state directly affects our body. For example, stress can lead to hypertension or stomach ulcers. People who are mentally healthy are at a lower risk for many health complications. Did you know symptoms of mental illness arise due to a physical change or medical condition? Traumatic brain injury can result in personality changes, although these changes are not always negative. Sometimes aspects of our lives can have effects on our thoughts and feelings, leading us to experience difficulties and problems. Well-being is not just about the lack of illness or the absence of sadness or worry. Well-being can be thought of as a combination of our physical, mental, emotional, spiritual, and social health. Often, simple things such as accepting a compliment, recognizing our strengths, or coping well with a stressful situation can help in getting us through the day and feeling mentally well. Connect with the people around us, with family, friends, colleagues, and neighbors, at home, work, school, or in our local community. Be active. Go for a walk or run. Step outside, cycle, play a game, garden, dance. Exercising makes us feel good. Most importantly, discover a physical activity we enjoy and that suits our level of mobility and fitness. Take notice. Be curious. Catch sight of the beautiful. Remark on the unusual. Notice the changing seasons. Savor the moment. Whether we are walking to work, eating lunch, or talking to friends. Be aware of the world around us and what we are feeling. Keep learning. Try something new. Rediscover an old interest. Give. Do something nice for a friend or a stranger. Thank someone. Smile. Volunteer your time. Join a community group. Mental health can also be defined as an absence of a mental disorder. Focus is increasing on preventing mental disorders. Prevention is beginning to appear in mental health strategies. Anyone can have a mental illness, regardless of age, gender, race, or income. Mental illnesses are more common than cancer, diabetes, heart disease, or AIDS. It is believed that 1 in 5 adults and children has a diagnosable mental disorder. 1 in every 10 young people aged 9 or older has a serious emotional disturbance that severely disrupts daily life, and 1 in 4 families will have a member with mental illness. The causes of mental illness are complicated. Mental health disorders in children and adolescents are caused mostly by biology and environment. Examples of biological causes are genetics, chemical imbalances in the body caused by genetics, lack of sleep or poor nutrition, or damage to the central nervous system, such as a head injury or fetal alcohol spectrum disorder. Many environmental factors also put young people at risk for developing mental health disorders. Attitudes towards mental illness vary among individuals, families, ethnicities, cultures, and countries. Cultural and religious teachings often influence beliefs about the origins and nature of mental illness and shape attitudes towards the mentally ill. In addition to influencing whether mentally ill individuals experience social stigma, beliefs about mental illness can affect patients' readiness and willingness to seek and adhere to treatment. People who are emotionally healthy are in control of their emotions and their behavior. They're able to handle life's challenges, build strong relationships, and recover from setbacks. But just as it requires effort to build or maintain physical health, so it is with mental and emotional health. Improving our emotional health can be a rewarding experience, benefiting all aspects of our life, including boosting our mood, building resilience, and adding to our overall enjoyment of life. What is mental health or emotional health? Mental or emotional health refers to our overall psychological well-being. It includes the way we feel about ourselves, the quality of our relationships, and our ability to manage our feelings and deal with difficulties. Good mental health is not just the absence of mental health problems. Being mentally or emotionally healthy is much more than being free of depression, anxiety, or other psychological issues. Rather than the absence of mental illness, mental and emotional health refers to the presence of positive characteristics. Similarly, not feeling bad is not the same as feeling good. While some people may not have negative feelings, they still need to do things that make them feel positive in order to achieve mental and emotional health.
Have you ever tried studying for an exam but just couldn't take in what you were reading? Have you ever forgotten everything you spent weeks studying for during an exam? Have you ever tried to talk to somebody you really liked and found you'd lost the ability to speak words? Our emotions directly affect how we think and behave. As a student, this is really important because our emotions are crucial to learning. Whatever your situation, you can take some control to improve your emotional well-being. Your emotional brain is stronger than your logical brain. Anger, sadness, fear, and anxiety cause your emotional brain to overpower your logical brain. This makes it difficult for you to think clearly or remember things. Luckily, you can calm your emotional brain down and take control. Breathing can really help. Take deep breaths down into your stomach, counting in for 7 and out for 11. Relaxing different muscles in your body, one by one, can also help to allow your logical brain to do its job. Living your life in balance and enjoying a variety of activities will help strengthen the thinking part of your brain. Exercise also reduces stress and helps you think more clearly. And you can manage your emotions by getting outside each day, doing things you enjoy, spending time with other people, eating healthily, staying hydrated, and giving yourself little treats.
Certain factors may increase our risk of developing mental health problems, including having a biological blood relative, such as a parent or sibling with a mental illness, experiences in the womb, for example, having a mother who was exposed to viruses, toxins, drugs, or alcohol during pregnancy, experiencing stressful life situations such as financial problems, a loved one's death, or a divorce, having a chronic medical condition such as cancer, experiencing brain damage as a result of a serious injury, traumatic brain injury such as a violent blow to the head, having traumatic experiences such as military combat or being assaulted, use of illegal drugs. Mental health is essential to a person's health and well-being. Mental health problems are found in people of all ages, regions, countries, and societies. There are a wide variety of things which contribute to experiencing such problems, but there are also a range of things which people can do to help prevent and improve any difficulties. It is important that awareness is increased about possible contributors to mental health problems, recognizing signs and symptoms, and also how to improve these symptoms and help prevent any problems from becoming worse. Research has shown that people who have good social support from family and friends are better able to deal with stressors and cope with change. Having support from other people seems to act as a protecting factor against mental health difficulties. Therefore, it is important to build support and to keep in contact with people even when we do not feel so good. It is probably even more important to have contact with those people at the times when we feel anxious or low in mood. Communication and expressing how we feel are a key aspect of mental well-being. When feelings and thoughts are not expressed, they do not usually just go away. This could build up to contribute to feelings of stress, anger, or low mood, which can also affect physical as well as mental well-being. It is important to keep a balance in life and make time for us. Think of things that we like doing and ways of relaxing. Sometimes it is good to have a hobby, interest, which is just for us to enjoy. It is helpful to take some time every day if possible, so that we can feel more relaxed and better manage any stress. Research has found that laughing has great health benefits, both physically and mentally. There are lots of health benefits to humor, and it is often used as a therapy. Out of these benefits is that when we laugh, certain hormones are released called endorphins. These endorphins help create a feeling of happiness, which helps reduce feelings of depression and stress. Therefore, this reduces potentially harmful chemicals that can be produced by prolonged feelings of stress. This also makes us feel more relaxed, and therefore we are in a much better position to deal with the not so good things that happen in day-to-day life. Having a healthy diet is very important for physical and mental health. Certain foods and drinks can affect mood. For example, caffeine can increase anxiety, and chocolate causes changes in blood sugar levels, which can sometimes result in periods of low mood. Serotonin helps stabilize mood, and when a person suffers low mood, this chemical is found to be reduced. Bananas have been found to help promote production of the brain chemical serotonin. Thinking positively is very important when considering well-being. Negative thinking can blow problems up and is associated with the development and maintenance of depression, anxiety. Once a person continues to think in this unhelpful way, they find it difficult to turn their thoughts to be more positive. The World Health Organization, WHO, identified several priority mental health conditions that represented a high burden in terms of mortality, morbidity, and disability, caused large economic costs, or were associated with violations of human rights. The priority conditions are depression, schizophrenia, and other psychotic disorders, suicide, epilepsy, dementia, substance use disorders, and mental disorders in children. Major depression is one of the most common mental illnesses, with a worldwide lifetime prevalence of approximately 12%. Symptoms of depression include sad mood, loss of interest in activities that used to be pleasurable, weight gain or loss, fatigue, inappropriate feelings of guilt, difficulty concentrating, and thoughts of suicide. Depression can cause problems at work, in personal relationships, and can lead to suicide. Depression rates are twice as high in women as in men. Although the lifetime risk for schizophrenia is only 0.08 to 0.44%, the symptoms that characterize the disorder can severely impair daily functioning. Schizophrenia is a psychotic disorder categorized by a variety of symptoms. Positive symptoms, behaviors that are induced by the illness, include hallucinations, perceiving stimuli that are not there, delusions, strongly held false beliefs, thought disorders, and movement disorders. Common childhood mental disorders include autism, Down syndrome, fetal alcoholic syndrome, and attention deficit disorder. Although the specific symptom set depends on the disorder, many developmental disorders are characterized by delayed achievement of or failure to achieve developmental milestones, limiting cognitive functioning, impaired language or motor abilities, and behavioral problems. Mental disorders usually are caused by a combination of genetic and biological factors, nature and environmental factors, nurture. Substance use and other medical conditions also can play a role in mental health problems. Although it is difficult to separate the role of factors in an individual presentation of mental illness, it is important to understand how these factors independently affect mental functioning so prevention and intervention can be implemented. Many mental disorders have a genetic component, meaning a predisposition or vulnerability to a particular illness can be passed down through family. According to the 2000 Diagnostic and Statistical Manual of Mental Disorders, DSM-IV-TR, individuals with first-degree relatives suffering from schizophrenia are at 10 times greater risk for getting the illness themselves compared to the general population. Major depressive episodes are between 1.5 and 3 times more common in individuals with first-degree relatives who also suffer from major depression. Now, in the end, let us summarize what we have learnt in this lecture. Mental health, which is commonly used in reference to mental illness. Mental illness is defined as collectively all diagnosable mental disorders or health conditions that are characterized by alterations in thinking, mood, or behavior associated with distress and impaired functioning. Good mental health means appreciating our achievements and accepting our shortcomings. Well-being is not just about the lack of illness or the absence of sadness or worry. Well-being can be thought of as a combination of our physical, mental, emotional, spiritual, and social health. Mental or emotional health refers to our overall psychological well-being. Mental health is essential to a person's health and well-being.